In this video, we're going to be exploring the rehabilitation process following an injury to help ensure that acute pain doesn't become chronic. My name is Carolyn Zeff, and I'm an athletic therapist and osteopathic manual practitioner. And I believe that by changing your state, story, and strategy, you can change your pain. Now, if you've had an injury that you sought out a medical practitioner's help to rehabilitate, the following 5 rehabilitation phases, their time frames, and the goals of each might look quite familiar to you. So first off, I'm sure you're wondering, what are the 5 rehabilitation phases? Well, they start out with the acute, and then they go into subacute, remodeling, functional, and return to sport, work, or life activities. Now, in the first phase, which is the acute rehabilitation phase, this happens within the first week after an injury. So as a practitioner working with a patient, the goal here is to minimize inflammation and pain. So this phase of rehabilitation is classically treated with the RICE method, which is actually an acronym that stands for rest, which means you stop activities that increase pain. And with some injuries, you actually may need to be non-weight bearing in this phase of rehab. The I in RICE stands for icing, which is you ice the injured area, and this helps with reducing heat and swelling. C is for compression, which you can do with a sleeve or lymphatic taping or a tensor bandage. And E is for elevation, if possible, to reduce the amount of swelling in the injured area. Now, still here in the acute rehab phase, it's important to keep the joint above and below the injured area moving. Now, depending on the type of the injury as well as the severity, you may also be possibly able to do some gentle motion in the injured area itself. This movement, though, needs to be done gently and in a pain-free range of motion. The important word here being pain-free. Pain in this stage of the healing game is important to listen to, as it helps you identify the fine line between maintaining your range and at the same time not compromising the healing that's happening in the injured area. Now, if you push the movement into causing your pain level to rise up a level or 2, this can create more swelling and heat and possibly redness, which are signs of inflammation. And this is actually indicating that further damage is occurring in the injury site. So that's no bueno. You don't want to do that. Now, in the second phase of rehabilitation, which is the subacute phase of rehabilitation, if the inflammation has been well managed in the acute phase of rehab, you can actually start into this phase as early as 3 days post-injury. The goal in the subacute rehab phase is actually to prevent muscle wasting or atrophy from happening by introducing isometric strengthening, which is actually doing a muscular contraction that is not noticeably changing the muscle length or moving even the affected joint. So then after a few days of isometric work, you can progress to concentric strengthening, which is strengthening that causes tension on the muscle as it shortens. So I was showing my bicep here, but like again, the isometric example is that the muscle is contracting, but not noticeably changing the muscle length, or even you can't even see my elbow moving. And the concentric example is that you would be resisting the bicep muscle when you come up and then just passively allowing the arm to straighten. Again, resisting, concentric contraction, that muscle is shortening against resistance and then relaxing back down. So both the isometric and concentric strengthening needs to be done in a pain-free range and at a level of resistance that your pain doesn't persist, or after doing the exercise, it doesn't get worse. So if it does, you need to decrease the intensity or the frequency or even the exercise itself that's being used. So now in the third phase of rehabilitation, the remodeling rehab phase, depending again on the severity and type of injury, you may begin into this phase as early as 1 week post-injury, or maybe about 6 weeks out after the onset of injury. Now in this phase, there's a focus being placed on strengthening and stretching, but the strengthening is slow, eccentric strengthening. Eccentric actually refers to movement that lengthens a muscle at the same time the muscle is being contracted. So again, using our bicep example like above, I'd be resisting as the muscle lengthens and then just bringing it back nice and gently. So as injured tissue is actually healing, it's laying down collagen or scar tissue in an unorganized, messy manner in an effort to give the injured area needed strength. But this causes the injured area to get really stiff and really tight. So that's why in this remodeling phase of rehab, the goal is to promote flexibility through stretching and eccentric strengthening. Now, side note here, before you start into this phase of rehab, it's super important that you make sure that the injured area is regenerated to prevent re-injury. Now, in the next phase, which is the functional rehabilitation phase, it can be started again maybe 2 weeks post-injury, and it can last actually up to 6 months. And the goal here is to return you back to your sport or your work duties or life activities without re-injury occurring. Now, during this phase, practitioners can get creative, putting together programs to correct muscular imbalances, increase strength, endurance, speed, agility, flexibility, proprioception, and anything that's really looking or mimicking the person's sport or movement patterns that they are going to be going back to. Now, in the final phase of rehab, which is kind of returning you back into full competition without limitations or full work or life activities. This could happen anywhere from 3 weeks post-injury. And again, I mean, it can last for about 6 months. And the main goal here is to avoid re-injury by establishing a good base of strength and progressions all the way through your rehab phases and addressing still any deficiencies and also psychological readiness to get back to work or sport. Now, promoting movement and exercise at an appropriate level for each stage of tissue healing really helps to minimize unhelpful modifications around pain, like fear avoidance behaviors. And executing a well laid out rehabilitation plan is part of the strategy in ensuring that acute pain doesn't become chronic. So I want to thank you for watching this video. If you enjoyed it, please give it a like and share it with a friend.